Today was World Menopause Day. It was established 39 years ago to break the stigma of menopause and encourage further medical research on the condition that affects half the world's population. Last week, I talked with a nurse practitioner who specializes in menopause. Well, these are the offices of Comprehensive Urology Institute in Canfield, and we're here to talk about menopause with nurse practitioner Mandy Corvino, who is a national certified menopause provider. Mandy, let's begin with what is menopause?
So menopause is 1 year without your menstrual cycle. The average age of menopause is 51, but that means you can go through menopause before 51 or after 51.
There's actually something called perimenopause, correct?
Correct. Perimenopause is the time leading up to menopause, and that can happen, believe it or not, as early as your late 30s. Average age of perimenopause is 45, but you can have symptoms well before then.
Symptoms. What are symptoms?
Symptoms can be hot flashes, night sweats, brain fog, joint aches, changes in your hair, skin, and nails. But more importantly, there are also silent symptoms like osteoporosis, cardiovascular disease, and problems with your pelvic health.
What do you suggest? How do women deal with this?
Well, I would tell them definitely to come see me, but what they do, estrogen is a great treatment option. It's gotten a bad rap for years, but all the medical guidelines have been updated, and estrogen is not as scary as what we once thought, and it is the FDA-approved treatment for a lot of your menopausal symptoms.
Estrogen is, they talk about hormone treatment. Is that what that is?
Yes, estrogen is a hormone treatment, usually prescribed in a pill, patch, or a gel.
Is there any way to get away from using estrogen if you want to balance your hormones, or is that the only way?
No, this is the only way. You can't balance your hormones on your own. There are non-hormonal options, but they don't have the added effect that what estrogen does, how it protects your bones, your pelvic health, and your cardiovascular health.
Are there any downsides to estrogen?
Not in my eyes. There's only benefits, and we've seen this time and time again through numerous medical reviews.
Doing the estrogen, what's involved in it?
You just come in, talk to me. I take a detailed medical history to make sure that you're a good candidate for menopause hormone therapy, and if you are, then I place you on a patch, a pill, or a gel, and then we go from there. We monitor your symptoms. I look to get on average a 70 to 80% improvement in your menopausal symptoms. It's very individualized. There's no standard for every woman who's perimenopausal needs to take this patch or this pill. All of my treatment options for my patients are based on their symptoms and are extremely individualized.
What do you do if a doctor doesn't want to take your symptoms seriously?
I would tell you then to see another provider and seek out someone like myself. I have gotten extra education and a certification. I am a national certified menopause provider. I will help you. You don't need a referral to come see me. Just come in, have a conversation.
Cortisol levels, do they rise when you're doing estrogen? And if so, can you combat that?
So that is a big myth. So you don't need to look at cortisol levels. Truthfully, we don't need a ton of labs to treat you. What's more important is replacing that estrogen that you're losing through the menopause transition.
And you're a believer in estrogen?
100%. All of the data that, many women hear estrogen causes cancer. That's not true. If someone's telling you that, that's misleading information. That study that scared everybody was called the Women's Health Initiative. All of those alarmist statements have been retracted. That's why it's important that you do have a conversation with your provider. We talk about risks and benefits, but estrogen is not what causes cancer.
Did we miss anything? Is there anything else you'd like to get in there?
No, I think we covered a lot of topics that are very important. Just know that you don't need a referral to come see me, and I'd be happy to help any woman with any of their perimenopause or menopause symptoms.
Okay, Mandy Corvino, thank you very much.
Thank you.
Hi everyone, I'm Lindsay Watson. Thanks for watching the WKBN 27 First News YouTube channel. If you want more video news, subscribe to our channel. And don't forget to download the WKBN 27 First News app for breaking news alerts.